most important pelvic floor exercise for men is a little bit different than women because of what I see in my male population, using the lower portion of their butt, like their glute. So if you have your fold in your glutes, that portion where it's very close to the anus but not the anus, they use a lot of that to basically go forward. So they use it instead of tilting and rotating the pelvis in movement, they tend to kind of shove the pelvis forward. So they're kind of over engaging the lower portion of their glute close to their anus. And the exercise I'm about to show you really tries to disengage that area and actually get the movement going. What I suggest to my patients to do is to get this exercise going just to get the pattern into their movement, but pay close attention to how to rotate their pelvis and rock it back and forth. So before we go, I just want to introduce myself. I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County, and I see a high population of patients with pelvic floor dysfunction because of the nature of work that I do, which does not involve internal manual work, because I'm more interested in stabilizing the house, your pelvis. That pelvic floor is the floor of. So let's go do this exercise together. Find a wall in your house and just lay down on your back and make sure that the small of your back is nicely closed, so you don't have this arch right here. You're closing that gap by not moving your chest down, but by rocking your pelvis up. So then you want to get close to the wall and place the outer edge of your foot or your feet on the wall. And what we want to try to do is we want to get our body, the lower part of our body, up towards the ceiling. If you squeeze the lower portion of your butt to try to lift you up, you're doing it incorrectly. So what I want you to think about is place the edge of the feet on the wall. You can place your hands here if you want. You're not pushing your legs up, but it's as if you're pressing into the wall and you're trying to rotate your legs, but you're not rotating. So watch this. You're pressing as if you want to move, but you're not moving your knees, and you're thinking about your pubic bone going straight up towards the ceiling. So this is all pressing into the wall with the side of my foot, trying to think about my pubic bone going up and stopping myself from engaging my lower part of my butt closest to, in your case, penis and anus, to engage. So you want to go up without the engagement of that. It's as if, so here comes the funny part, it's as if you're trying to fart. If you were to fart, you would not be squeezing your anus. So have that, as silly as it sounds, have that image in mind so it relaxes that portion of your glute, and try to move your pubic bone towards the ceiling. When I do this with my patients, with my male patients, they really have a hard time disengaging. So give yourself a chance, and do know that there is a lot of practicing before you get it right, but don't give up. If you have any questions, or if you think you have pelvic floor dysfunction and you're ready to start your treatment, give me a call. Use one of the methods of contact in the description box, and let's see if we can schedule an appointment with you, or schedule a coaching session with you, depending on what's going on. Thanks for watching.